Hello friends, we meet again. Today I will be talking to you about surrogacy. What is surrogacy? Surrogacy is again a treatment wherein we have a third party, like another lady, carrying the baby for the patient. Again, in this there are various forms. There is gestational surrogacy, there is traditional surrogacy. Traditional surrogacy involves using even the gametes of the surrogate with the surrogate carrying the pregnancy, and only the semen of the husband or the patient being used. In gestational surrogacy, gametes are not of the surrogate. They belong to the couple, to the patients. It's their genetic child. The surrogate is only a carrier where she is carrying the baby for the patient. In India, we are allowed to practice only gestational surrogacy, and for this, I will now restrict myself to speaking only about gestational surrogacy in this video. So again, what do we have? Who are the patients who really require gestational surrogacy? These are women who are born without a uterus or a very small uterus, which is termed as MRKH syndrome. These are women who have had recurrent pregnancy losses. They have had at least 2 or 3 losses wherein they have not been able to carry a pregnancy to term. Patients who have had medical conditions, be it any psychological problems or be it medical problems related to maybe high sugar levels, maybe heart conditions, maybe even liver problems. Again, there are a few other women who, because they have had past history of some diseases like tuberculosis, have resulted in a frozen pelvis. What is frozen pelvis? In this, it so happens that the uterus, the tubes, ovaries are all stuck. They are not able to carry. Few of them again are able to carry the pregnancy, but a few aren't. Those who have had history of cervical cancer, or maybe they have had history wherein they have been operated upon in the uterus, or patients who have had large adenomyotic uterus and have had repeated losses because of the same, or they have not had a pregnancy that has gone up to term. Having understood these conditions, let us see how does this work. Typically, this involves the beginning of an IVF cycle wherein the patient, the female patient, will need to undergo injections to stimulate her ovaries so that the fertility physician is able to retrieve her eggs. Once we have the eggs, they are then mixed with her partner or her husband's sperm in the laboratory to form embryos. These embryos that are then made are transferred either on day 3 or on day 5 into the uterus of the surrogate mother. Again, the surrogate mother needs to be prepared. She is a lady who undergoes tests including even psychological evaluation to know that she is mentally and physically all right to carry a pregnancy to term. This surrogate mother is then prepared with hormones so that her uterus now becomes acceptable to carrying a pregnancy to term. This embryo is then transferred, is then carried by the surrogate mother up to 9 months, where she follows up regularly under the supervision of an obstetrician and finally gives birth to a baby. The baby then belongs to the genetic parents. The birth certificate will have the name of the genetic parents and not the surrogate mother. The surrogate mother's duty is complete once she hands over the baby to the genetic parents. Thank you. Next week, we will speak about what is endometriosis and how does it affect fertility?